injecting medications, and suturing during surgery. The FDA and OSHA now recommend the use of breakage-resistant blood capillary tubes to decrease exposure. Your exposure control plan details sharp safety rules you should follow. Here are some general guidelines. Use a safe needle device or needleless system for withdrawal of body fluids, accessing a vein or artery, or administering medications or fluids. Also, when available, you should use either a needleless system or a needle with engineered sharps protection for any other procedure requiring needle devices. For instance, needleless systems and recessed needles are available to connect adjoining IV equipment, a practice known as piggybacking or intermittent IV. Disposable needles and phlebotomy equipment are available with engineered sharps protection. Non-needle sharps, such as certain types of surgical equipment, shall include engineered sharps protection. Safe needle devices and non-needle sharps devices are not required if they are unavailable in the marketplace, if their use may jeopardize a patient's safety or a procedure success, if their use hasn't been proved to increase employee safety. You will be trained in the proper use of any sharp safety devices you're required to use. You will also help evaluate their effectiveness. When using sharps, always follow effective, safe handling techniques to prevent injury. Never shear, break, bend, or recap contaminated needles or sharps, except in cases when recapping is required by the procedure. Then, use a resheathing device or a one-handed scoop method. Never reuse disposable sharps. Discard contaminated sharps immediately after use in an appropriate puncture-resistant, color-coded container. Nearly 1/3 of all sharps injuries happen during disposal. NIOSH suggests this risk can be decreased by placing sharps containers within easy reach and slightly below eye level. Do not allow containers to overfill. Never reach into a container of contaminated sharps. And remember, sharps include broken glass. Do not pick up contaminated broken glass with your hands. Instead, use a broom and dustpan, forceps, or tongs. Report all sharps injuries as directed in your exposure control plan. Document the sharp exposure incident, including date, time, and type of sharp used. Next, evaluate the effectiveness of any safety device used, and note how the injury could have been prevented if possible. Your information will be entered into the sharps injury log, where it will be used to judge the effectiveness of current sharp safety devices. Do not panic if you are exposed to blood or OPIM. Immediately wash the exposed skin area, needle sticks, and cuts with soap and water. Flush eyes and exposed mucous membranes with large amounts of clean water. Do not use caustic agents such as bleach. Your next step is to report the exposure to the designated person immediately, so that post-exposure evaluation, counseling, and any necessary treatment can begin. Act quickly, because with some infections, treatment works best when you start it right away. And remember, exposure does not always lead to infection. To become infected, a large enough dose of the live virus must enter your bloodstream and overcome your body's defense system. To put it in perspective, here are the risks of contracting a blood-borne infection after a sharps injury. Studies report the risk of acquiring hepatitis B, for those who have not been vaccinated, is from 6 to 30%, or about 1 in 6. For hepatitis C, it's from 2 to 10%, or about 1 in 20. And for HIV, the risk is approximately 0.3%, or 1 in 300.
Now you have a sharper image of blood-borne pathogens. The risks of infection are real and should be taken seriously. But we are making progress in our mission to learn more about BVPs. Right now, our best tool is to follow work practices designed to keep us safe.